No, the internet.
Rich, y'all stand by.
It's a conspiracy. Sorry, it's a
I think
conspiracy.
Russians are part of it.
Doors must be locked and closed. Doors continue working on and working. Oh, he's talking about the retail license.
Good afternoon, and wanted to thank everyone for joining us here at Dothan Houston County EMA. An update from the Joint Information Center. This was an opportunity today. We did not have a scheduled update or a major release date today, but our leaders wanted to take an opportunity before the weekend to get together and go over some of the procedures and precautions set forth by the Alabama Department of Public Health, what's being done in our community to help prevent the spread of the COVID-19 virus, and some suggestions for the weekend as we move forward as an update. So I wanted to ask Mayor Mark Saliba to come forward and provide some comments, and then Chairman Culver will also be joining.
Good afternoon. I want to take the opportunity first to say thanks to a lot of people, because at this point in time we need to be thankful for one another and the job that we have been doing so far. So I want to say thanks to our two Chris's for manning our Joint Information Control Center, EOC. I'm grateful for all that they have been doing and trying to get as much information here. And by the way, whether you're a nonprofit or not, or you're a for-profit, or if there's any types of activities that'll be going on, please call them and let them know. They want to be able to make sure that the information is shared with other proper authorities. So I want to say thanks to them. I want to say thanks to all of my buddy over here to the right, Chairman Culver.
That's not what you said a minute ago.
We do have a great relationship, and I hope that this is not the first time you've heard that. We have been saying that for a long time, and it makes a big difference in what we can get done in a community when our city and our county gets along like it does. So thank you for all that you do and all that relationship. First and foremost, I want to say to please keep in your heart and your mind all of our healthcare workers, the hospitals, the doctors, our emergency responders. If we were at war, these were the guys that are on the front line. And we need to be mindful of them and what we are asking them to deal with day in and day out. And if you don't hear anything I've said today after this, that is what's extremely important, because their protection is part of the reason why we have the protocols that are being put into place by the Alabama Department of Public Health and the Governor's Office. So please, I want to say thank you to both hospitals and all of those that are out there assisted living, that are taking care of parents, grandparents, and family members, because we know that they are most at risk. I want to take you back just one moment. Chairman Culver says I get too wordy sometimes, but I haven't been in front of you a lot, and I want to make sure that I get to say what I want to say at this point. I want to take you back to October 10th of 2018. And in a relatively short period of time, days, matter of fact, we had a tropical storm that went to a Category 5 hurricane. That was Hurricane Michael. And as it approached the coast, we all wondered what we would do and how we would respond. And within hours, it changed. Approaching the coast at 160 miles an hour, made landfall near Mexico Beach. It skirted our area just to the east of us. And that night, during the next morning, we woke up and nearly 24,000 of the city of Dothan's 30,000 electrical customers were without power. There were another 17,500 people on Wiregrass Electric as well that were without power. those seem to be insurmountable odds against us at that time. Now, I know going forward from those days, there were a lot of people that questioned protocols and why are you doing this? Well, why didn't you do this? Or as we go forward, why aren't you doing more? Or why are we doing less? Or how long is it going to take? Expectation levels change from person to person. Different people have different expectations. But I want you to know, beyond a shadow of a doubt, that we take this very serious. We took Hurricane Michael very serious. We take this pandemic very serious. Do not be fooled by whatever information that you're getting from wherever you're getting it from. We take this very serious. Information is critical, and I want to make sure that you are going to those places that you can get the best information. I want to, of course, point you into the CDC, their government website, the adph.org, Alabama Department of Public Health. I go to it several times a day. The governor's office, governor.alabama.gov. All of these are websites and entities that we are getting our protocols and guidelines from. And we trust them, and we feel like they're doing a good job with what they're doing. I say that about the information being critical and where you're getting it from, because just within the last 30 minutes after the press release, I've gotten 5 phone calls at the city wondering what was going on about needed to be inside at a curfew because there was going to be some spraying going on and it could be dangerous to your health. I have no clue where that came from. I've got no clue how anybody could create that, but there is no spraying going on. And that's the kind of information that only causes panic. We just need to be smart. Since March 13th, everyone in this effort that's here today has exhausted every single resource that they have. I want you to know that because I think it's important. Not only those that have been manning the Joint Information Center, but at the county, at the city, at the state, and at the federal level, we have been working day and night on what resources we can pull in to place to help this community get through this pandemic. I have been on more conference calls in the last 2 weeks than I have been on in the last 2 years. I have been on conference calls with the governor and her cabinet. I've been on conference calls with Dr. Mackey. I have been in conference calls with the other 9 of the Big Ten mayors of the city, which has been very, very helpful to get a perspective of what each city and community is doing. Because what may work in Birmingham, what may work at Tuscaloosa, what may work in Huntsville may not be what we need to do in Dothan as well. Each community needs to take a good hard look at what the numbers are, where we are, the type of community that we are, and come up with the protocols for there. We will continue to get our guidelines from the Alabama Department of Public Health. Until we see that we don't need to do that, we are going to follow their guidelines because we feel like that they have been leading us in a good place. The last release from the governor's office has a new list of essential and non-essential businesses. And quite frankly, that was a little bit of the equation that I had a lot of question on. And so we now have some categories of which those businesses have been classified. We are still studying those classifications and studying that press release. I did not know at 11 o'clock that press release was going to happen. We could have maybe done a little more research and been able to tell you a little bit more today at 1:30. But we will, and we'll figure out what it is that we need to do. What's important to me is that we provide the services in the city and the county in our area, because it's not only COVID-19 that's going on. Every day, there's someone out there that may have a wreck on our street. There might be a fire. I was walking up to WTVY earlier, and I heard a fire truck going down the road. We have emergency responders that are having to respond to everyday calls at the same time dealing with COVID-19. This is a very unusual situation. Please know that we are going to do everything within our power to continue to provide the great service that we need to provide as a city, and do it safely for not only our employees, but our citizens as well. There is no doubt in my mind, just like with Hurricane Michael, we are going to defeat this pandemic one way or the other. We are a strong city, we are a strong county and community, and we will come out of this in a strong, caring, and compassionate way. I'm going to yield the floor to my friend, Chairman Coffey.
Thank you, Mayor. And I appreciate your comments about us working together. We have always done that, and we've said it over and over many times that that's one of the reasons we are a strong community, is that we do work together. We try to coordinate, cooperate, and collaborate, and we do a good job of doing that. I think you can look around this room on almost any day, and the two Chris's who come from both city and county are doing a great job of trying to coordinate the information so that our citizens get the most accurate information. I will say that has not always been the case. I will also say that in the last hour or so since the governor's new health order has come out, there has been some misinformation. You mentioned 5 calls about spraying. I've gotten 20 calls just on my cell phone about my business. Yeah, I wish the people that are texting me right now, please stop so I can look at the information I've got here, because I need to put this information out. As the mayor said, we're still evaluating the new order. We do know that the new order does lower the number of people that can group together from 25 to 10, as the president has asked. So any groups that you have out there, please, no more than 10 people together. I know we talked earlier, some of the things you don't think about that are ongoing are not just public gatherings of a general nature, but church gatherings like funerals and weddings and those kind of things. You've got to think about those. We don't need this virus passed at those type activities, which are very important and very essential to life, but at this time we've got to think about those. This is a very, very aggressive virus from a contagious aspect. It's not so much a killer percentage-wise, but it is an extremely contagious thing, and we've got to be aware of that and listen to the advice we're getting. Most of the calls that we've gotten, I think, relate to business closings, and I think the businesses that are closed or being asked to close has been expanded. There is a list in there. It has been expanded to some retail, and I need to pass on from the Chamber and BCA, those businesses that are closed in this order. It's our understanding you can still do online sales. You just can't have your doors have to be locked and closed to the public. You can still do curbside. This curbside, I don't think there's any changes to our restaurants from what they were previously ordered based on the information that we've gotten, but there are some expansions as far as particularly in the retail area. So we want you to get the accurate information. We want you to understand exactly what the state is ordering you, but we also want you to understand that from our perspective, the limit of what we are asking you to do is this order. There aren't any curfews in place. that we're aware of yet. There aren't any total shutdowns like you've seen in some cities. We have faith in our people, you, our citizens, that you're going to do the right thing as you have been doing. You look around our community and you can see that we are voluntarily sheltering in place. You're voluntarily doing the things that our president and our governor and our leaders are asking you to do. And as long as we continue that, I think that's going to hopefully meet our needs. Yes, we've got to abide by what the state asks us to do and what this order says. But at this time, I don't think, unless things get worse, that we plan to do anything any further than this. So please get the right information. Get it from this office. Get it from the places that the mayor mentioned, and make sure you're acting on the right information, not some rumor mill that's out there. There's plenty of places to get the right information. I also want to mention, I've been in contact. As you know, we operate as a region here. We don't just serve our citizens in Dothan and Houston County. I've been in contact with our friends in the surrounding counties, and they're looking at and taking the same type of steps that we are here in Houston County. As far as our government, yesterday was the last day we'll be actually having any contact with the public. We are not, all of our offices now are shut completely to the public. We'll still be doing online and all those type of things, but we just want everyone to know that there's no contact with the county employees and the public anymore. So we appreciate everyone doing their part. It was, I think I told the mayor Sunday, it was an interesting day in our community when I went out and picked up some things I needed to do around the house. It's been a long time since I've seen so many families out in their yards playing games and doing things together. And, you know, at times like this, sometimes it's good for us to look and try to find good. And that was a good thing, that we're all spending quality time together, and let's continue to do that as we are staying home and getting this virus out of our community, our state, and our nation. So, Chris, you're coming up here like you want to say something.
Yes. As we always do, want to open the floor for just a moment for a few questions. So as we're getting ready for that, I want to reiterate what the mayor said. A number of things that I think were critically important. Number one, following the guidance of ADPH and the CDC and supporting where we can each other. He spoke of first responders and our healthcare workers. Also keep in mind our dispatchers, public safety telecommunicators that are also dealing with this. They may not be face to face with our citizens and those who are calling for help and calling for emergency assistance, but they're critical to us as responders because they have a line of questioning that can help us prior to arrival. They can help us alert the hospitals faster that we may have someone who has been exposed or may be infected. So it's critical that we continue to remember them as we all have a part to play in this. Whether it's your part is staying at home and staying isolated, if you will, and following these orders, that's critical to the success. You don't have to be a responder, you don't have to be a healthcare worker to make this thing go away. It's to follow these directives. So I'd open the floor for questions. One thing that we've been asked because a number of online viewers is that we repeat the question because they're having trouble hearing some folks. So I'll try to do that as the person answering comes forward to answer that.
No questions?
I'll begin, if you will, and I'll try to do it in a very orderly manner so you don't have to keep coming back and forth. Let me begin, if I could, maybe with you, Mayor Saliba. Unemployment claims in Alabama this week, in the first 4 days of this week, is 60,000. We keep closing business. This is going to put more people out of work. Certainly there is the health side of this issue. How do you think the state of Alabama, and more specifically in the role that you have, the city of Dothan, can strike the balance for what's best for everybody?
So the question, if you didn't hear, is, and I'm gonna put it in my words, is there is a balance between a medical impact and an economic impact. Unemployment claims have already skyrocketed over the last 2 weeks. The number changes by the hour. And so what is our thoughts on how to accomplish that balance over the coming weeks? Is that correct?
Yes, sir.
Okay. So unemployment is a very, very important topic for us. We were at a meeting just yesterday at the Chamber of Commerce where the whole topic was around what monies that are becoming available from the federal government, how are they going to get here, from the state as well, what's going to be available, and most of what our meeting was for was to try to get as much information in one place, mostly through the Chamber of Commerce, that will be able to answer those questions. Because on my heart, probably as big as the medical impact is the fact that in Dothan and Houston County, a lot of our demographic is living from paycheck to paycheck sometimes. And so it's easy for one person to say they're going to shelter in place. It's life-threatening for another one in an economic way. Therefore, we have to find some kind of balance. I think that's the nation's struggle right now, both in national leaders as well as the state leaders, and then trickling down to us as community leaders. What is that balance? And I think that's changing day by day and week by week.
Can you help me understand what stores will be closed and what stores will be open? Or do you, and I understand you did not have that directive. Or Chairman Holder, thank you, sir.
Yeah, I can tell you what the order says, and then we can.
I was looking for specific stores.
Well, I'm not gonna sit here and name 1,000 stores in Dothan that are closed.
Okay.
No, I'm not gonna do that, Ken.
Okay, will Target be open?
I don't know if Target's gonna be open or not. I would say probably it would be, because they have groceries. Grocery stores are open. That's Mark's opinion. The stores that'll be closed are furniture and home furnishing stores, clothing, shoe, and clothing accessory stores, jewelry, luggage, and leather goods stores, department stores, sporting goods stores, book, craft, and music stores. Now, that's just in the retail arena. You know, there's also service providers like barber shops and nail salons and whatnot, athletic facilities, entertainment venues, concert venues, all those kind of things. This information will be available on the website. Corey, you wanna address that?
Well, Mr.
Well,
Chairman-
hold on, Corey wants to address that. Come on up.
Go ahead, Mr. Kirkland.
Sorry, I may not have heard the very last part of that. I would agree with him that the Target, Walmart, those kind of places will remain open because of the groceries and the cleaning supplies and things that they offer on a mass scale. I would agree with that one.
I guess my question is this, and I understand them being open because they do have groceries are very essential to our everyday lives. My question is, you should say, for instance, shoe stores have to close, clothing stores have to close. So people then, if they want to buy shoes or clothing, have to go to Walmart. So should Walmart be allowed to sell those products, or is that, is that competition?
Online.
I'm sorry?
My guidance has not gone quite that far yet, so I think the mayor wants to address that all.
But you do see the point I'm making.
I certainly do. I understand it can be a problem for lots of people.
6 feet, everybody. I think it's a great question, and it needs clarification. It's about, sometimes it's clear as mud to me. A lot of times the things that we get down from high or above. I think that if you don't know the answer to that, to the questions in the category you're in, I would prefer you either to contact the county health department. I would say you probably could contact our city admin office as well. We're going to need to help people be able to make those decisions and answer those questions. I'm not going to be here today to dodge anything. We're going to work this out as we go. I would say that as well, if you don't know, it's always best to say, if I can do this with a locked door and deliver goods curbside, that's the way to go. And so if your business is where you can stay in business and be able to deliver goods without having people come, non-employees come into the business, then you can probably stay open unless it's in one of these categories specifically.
Mr. Mayor, I've only got one more question.
Let me comment on that too.
Yes, sir, Mr.
You can
Chairman.
also, and that was what Dean had texted while all these other texts were coming in from the chamber, you can still order from these businesses online if they have that presence. So just because they are closed, the front door's closed, doesn't mean they're not available to do business. You can order online, you can get shoes or whatever you need if you want particularly to order from that particular store. But this guidance is coming from the health department, and, you know, we're trying to keep people safe. We're not really worried about advantages one way or the other. We're trying to keep our public safe and out of their facilities.
Yeah.
And one more question for me, I'll be very brief. We received a complaint, I've not done due diligence on it yet, saying that an apartment complex is going up on people's rent today. I know you have no control over that, but at the same time, is that concerning to you during this day?
I think that anybody, any citizen that's out there that feels like they're being price gouged or unfairly treated, you know, there is always this Attorney General on the state level, and that would be the best place to go. It's just hard for me just to stand here and not say, you need to give me a call, because I need to know about it. And I think for me to dodge that is just not what I should be doing. If people are raising rents for whatever reason, I would suggest you please reach out to the person that you're renting from, see if you can understand why that's taking place, and exhaust all other opportunities. The city or the county has no jurisdiction over that, as you pointed out, but we don't want to feel like our citizens are abandoning them either. But that's going to be a little tricky, and I think that the Attorney General or the District Attorney would be a good place to start.
Question for Mr. Kirkland, just one thing. We have a doctor's office in town, a medical practice, if you will, that is giving, quote, a coronavirus test. I went down and inquired about it. They say, well, it's not your normal test, it's an antibody test. It cannot determine that within if you've been infected the prior 5 days, but it's more accurate if you're outside that 5 days. Your opinion on that test, and should people be taking those?
I think that's a decision between them and the provider. We don't have any formal guidance on those right now.
Nothing illegal?
There's nothing illegal about it. That's certainly up to him if he wants to provide that service.
Thank you for your clarification.
Any other questions?
Will the, Chief Etheridge, will the medical providers be speaking now?
Say that again, sir.
Or are we going to hear from the?
If you have
a question.
If you have specific questions, they did not come with a prepared statement
Right.
today for any new release of information. They were here supporting our community, and if you had a specific question, I'm sure that they would be happy to.
Now, a question from Ms. Darnell. Why other hospitals in Alabama are releasing their testing numbers and Flowers Hospital is not? It is a frequently asked question about this department.
Yeah, we've,
If you can come up. And if you will, just introduce yourself. The
Sure.
question was about testing being done at Flowers Hospital.
Sure. My name is Matt Blevins. I'm the Chief Operating Officer at Flowers Hospital. As of midnight, Flowers Hospital has tested a total of 38 patients for COVID-19. We currently have 6 tests pending. We've had no confirmed tests at the hospital yet. We have been and continue to report our testing numbers and results to the Alabama Department of Public Health. We are also reporting those same numbers to the Alabama Incident Management System. Because these numbers are so fluid and change often, we are referring these types of questions to those state agencies, as they will have an accurate number for our community as the situation evolves.
Understood. Thank you for providing those numbers, but at the same time, people want to know about the test here. When you send to the Department of Public Health at the state level, they get meshed in with others. And I would suggest, why can't Flowers Hospital do what the people at Southeast Health done and just make those available to us? We don't care about gender. We don't care about the age. How many did you test? How many are positive? How many are pending? That would be a great help when we go to sort out this for our viewers?
As of right now, we are sending all that data, as I described, to the Alabama Department of Public Health. The CDC can also see those numbers, and we're relying on those organizations to get that information out to the proper people. Thank you.
Any other questions?
This weekend, will the Alabama Department of Public Health have their phones manned locally, or where people can contact if they have questions over the weekend?
The question was asked about the Alabama Department of Public Health. Will they have their phones manned this weekend to answer any questions?
I have not decided at this point. We do have two ways for the public to contact Montgomery directly with general questions. There's also a line that's dedicated for healthcare professionals to be able to contact them. My staff will be working. If someone really needs something from us, we certainly will take that. But as far as having someone dedicated to it, I don't have anyone at this point.
Mr. Mayor, this does not come off my allotment of questions, but you may want to speak to the fact last weekend, or maybe Mr. Cowper is better suited, the Dothan Police Department put out their advisory that they might start issuing citations for those who break the gathering limit. Again,
Well, we've been
not my
given-
question, your opportunity.
Yeah, sure, be glad to answer that. The governor and her string of press releases that have been put out over the last couple of weeks, one of them specifically talked about both the police department and the sheriff's department has the authority and the ability to help enforce the protocols that have been passed down by the Alabama Department of Public Health with the intent of just, hey guys, it says don't have more than 10 and y'all have 50 people out here in the front yard partying. We just can't, that's not gonna help us flatten the curve. But we have that authority.
I need to clarify one thing. I got a text from some of our public safety folks. I mentioned about county employees and that we weren't interfacing. Obviously, public safety folks, our sheriff's people, sanitation, those kind of people will continue to do their duty. They are certainly essential and classified as essential, and they will continue to do what they need to do to keep our people safe, to get your garbage picked up and those kind of things. But I was primarily talking about those that in office staff and provide other services. So I did get that text and wanted the sheriff to be sure he knew that I was going to let people know that. So, thanks.
Okay. All right. Any other questions?
I want to know, are pending cases being quarantined?
Are pending cases being quarantined? That would be a Corey better question.
You answer that, you're good.
The pending ones are being isolated. They're given instructions on how to do that at home. The ones that are testing positive are the ones that we actually give quarantine orders to.
Anything else? Okay. Anybody else? We'll make sure everybody's had the opportunity to ask every question they want to get answered. You didn't ask me about sheltering in place and that terminology.
I was happy to, Mr. Mayor.
Let me tell you my thoughts on that,
All right,
okay?
sir.
First off, I have learned a lot about terminology over the last 2.5 weeks. Terminology that I wish I had rather never had to learn, but I have. One of the terms that I think has been used that's been a misnomer, and that is shelter in place. And it's been so eloquently told to me is that is an emergency management type terminology. So for instance, if I have a railroad car that's got filled with ammonia and it goes over and it leaks out, the order comes out, shelter in place. That means do not leave your home because it is dangerous for your health. Do not leave your home. I have studied and looked at every shelter in place, every stay-at-home order. I've read the ones in New York City. I've read the ones in California. I've looked at the one in Birmingham and Tuscaloosa. And if we'll follow the Alabama Department of Health's guidelines, then we will be doing what we need to do and trying to strike that balance that someone asked earlier about between economic and medical impacts. Does that help?
It does, and just to clarify, the governor gave you, as in all mayors, the authority to go beyond the boundaries of what we've heard today, if you believe they are necessary.
Yes, there is. Now, again, that Attorney General's position, if you had read that, and, you know, again, not it's clear as mud. What it really says is that we have the authority to get the blessing of our county health department and the Alabama Department of Health. If that plan meets their guidelines, then we can do that as well. I think the thing that has been most interesting to me and that has been very helpful to me is to have the ability to be able to talk to the other top 10 cities and hear where they're coming from, the specifics of each of their cities, what they're dealing with, the type of demographic that they have there. And so that each one, there's only 2 of the 10 so far that have felt like that they need to take it further than what the Alabama Department of Public Health is asked to do.
And my final question, whoever can answer it, can someone please clarify for me and for our viewers how many positive cases there are in Houston County, and help me understand where those people are? I don't mean specifically. Can somebody do that? It's very confusing, Mr. Kirkland, because we don't count out-of-state cases, and frankly, last night, we can't figure out where a Houston County case is.
The best thing I can tell you is to go to that dashboard that's on our website. It's updated every hour, and it's pulling straight from the database that we have where we do our disease investigations. So when that positive is recognized in that database, the dashboard is updating based on that. Georgia, I know that's confusing, but Georgia takes over those cases. We are a coordinating agency at that point. If they need help with us, they call us. But there's going to be positives in this part of the state. They're going to probably be in Florida at some point and in Georgia, but the dashboard is going to have your Alabama citizens for Houston County and for all of our counties.
So how many people, let's leave the Georgia people, the out-of-state people, what are there, 3 of those now?
I'm not sure off the top of my head because things are changing so fast. I haven't kept up with the
Leaving
states.
the out-of-state people off the count, how many people are positive on Houston County numbers at this point?
When I last looked, it was either 3 or 4, and I have not looked at the dashboard, continuously all day, and it probably has updated a couple times since I've been gone from the office. So I'd have to look at it myself right now to make sure. I can also have our staff look at our database, and we do check that to make sure that it's accurate from what we know. We have had a little bit of trouble with some addresses in the recent past, and we've helped to correct that and make sure that the county where that person lived and the address that they gave us was tallied with the correct county. I think with the volume that we're seeing of positives in a database that just a few weeks ago, 10 times less volume in it than what we have now. We're just trying to do our best to make sure that we're notifying people, make sure that it's accurate. But it's just a huge volume of positives that they're trying to work. The dashboard is still the best way right now, I can tell you, to keep up with it.
I'd like to answer that too.
Thank you, Mayor.
I understand that there is concerns, and there's always the conspiracy theorists out there that think that there's something that's being hidden. There's not. We are following the Alabama Department of Public Health guidelines because what's extremely important, here again, this is things I'm just now learning, I'd rather have not had to learn, and is that when they find a case that tests positive, an investigation has to be done so that we know where it originated from if we can, who they've been around, who could have been infected. And so all of that information has to be funneled through the Alabama Department of Public Health. There is no conspiracy. To be quite frank, I thought our number was going to be way higher this weekend than what it is today. I was expecting much more than four. So, quite honestly, I think that we are in a much better place with the numbers that we have seen than most other communities. And that's not just because of testing. I think we're about to close out. I want to thank again Chairman Culver and Corey Kirkland, Chris, all of you, Southeast Health and Flowers Hospital for being here today. There's one group I'd love for you to continue to keep in your hearts and on your mind, as well as the hospitals and first responders and healthcare workers, and that's our nonprofits. Our nonprofits are out there desperately trying to hang in there and provide a service of which, if we did not have the nonprofits in this community, there would be a lot of people that would suffer from a number of things and issues. So please, I beg of you, keep the nonprofits on your heart and in your mind. And on a positive note, because there are a lot of positives that we can be. We are doing a great job in the city and the county of combating this disease and maintaining services. We have a wonderfully compassionate and caring community, and we are going to withstand this challenge. I am totally convinced of it, and I am not wavering from that. I appreciate the media, because questions are out there that need to be answered, and I appreciate that. Thank you.
Thank y'all.